So today I'm going to be doing medication administration checkoff. The first thing I'm going to do is before I go into the room, I'm going to check the order on the MAR. So I'm checking my order and I see that I have an order for a multivitamin, 1 tablet by mouth, an order for iron 65 milligrams by mouth, and a Rocephin IM injection for 250 milligrams. So once I've checked that order, I am going to knock before I come into my patient's room. As I'm coming in, I'm going to perform hand hygiene. I'm going to close the door behind me to provide for privacy. I'm going to introduce myself to my patient. I'm going to tell them, hi, my name's Jordan. I'm going to be your nurse today. I'm here from 3 to 3. I'm going to be giving you your morning meds. I have your iron, I have your multivitamin, and then I do have an IM injection for you of Rocephin, which is an antibiotic. So once I've done that, I'm going to get all of my supplies and my equipment gathered. I'm going to gather my medications, and then with gathering the medications, you want to perform 3 checks. You want to make sure that you're doing your first check at the MAR, doing your second check when you are pulling the meds from the Pyxis, and checking that the order is correct on the Pyxis with the med that you've just pulled out. And then also you want to do your third check when you're placing your medications in your med cup to hand to your patients with the MAR again at the bedside. So once I've done that, I'm going to perform my hand hygiene. I'm going to put on clean gloves, and I'm going to draw up my intramuscular injection. So I'm getting an alcohol swab here. And I'm going to clean the top of my Rocephin vial. So I'm going to draw up 1 ml. So I'm going to pull back on the 1 ml and I'm going to inject the air into my vial for the 1 ml that I'm going to be pulling out. So once I've drawn that up, I'm going to recap my needle, and I have my medication drawn up. So once I've done that, I'm going to take all of my medication. So I've got my 2 meds to give, my multivitamin and my iron, and my IM injection. And so I am taking those to the bedside. Before I give these medications, I'm going to access the MAR to do that third check, and then I'm going to ask the patient their name and date of birth, and I'm going to check the wristband to make sure that they've told me the correct name and date of birth. I'm also going to ask the patient if they have any allergies. I might also ask if they have any allergies to the medications I'm about to give, because sometimes I feel like if you ask patients if they have any allergies, they sometimes will be like, oh, no, or I'm allergic to cats or something that's not related to the medication. So I'm going to ask about the allergies. I'm going to hand my patient their 2 meds in the cup, and I'm also going to hand them their water cup. And I'm going to stay at the bedside with the patient until I've seen that they've swallowed both of those pills, and I know that for sure that they've taken them. So now that I've done that, I'm going to perform hand hygiene again. I'm going to put on a pair of clean gloves. So with this being an IM injection, I am going to give it in the deltoid muscle. So I'm going to take another alcohol swab and I'm going to cleanse that site, working from in to out. And then with the IM injection, you want to displace the tissue, so you're going to use the Z-Track method to do that. And then I'm going to insert my needle at 90 degrees. And I've also got my gauze ready because in case there's any bleeding or anything like that. And then I also have tape if it's necessary for the patient. So I've displaced the tissue and I'm going to insert the injection at 90 degrees. And then when I pull the needle out, I'm going to activate the safety device. And then I'm going to dispose of this in the sharps container. So I've got my gauze ready. I'm just going to hold that there. And then I will apply just a little piece of tape for my patient. And so now that I've done that, and I've passed all of my medications to my patient, I am just going to clean up all of my supplies and my equipment. I'm going to remove my gloves, performing hand hygiene. I am going to lower the bed to its lowest position. I'm going to make sure the bed is locked. I'm going to hand my patient their call light, water, cell phone, any personal items that they want to have within reach. And then I am also going to thank them for letting me do their morning med pass, and then exit the room.